My name is Anna Neri. I'm the medical coordinator of MSF France in Yemen. About the latest news regarding malnutrition, there is a current food crisis in the country that has been exacerbated by the blockade and the ongoing efforts of limiting supply into Yemen, especially in the north. This has reflected in the number of cases that we see in our health structures of children, especially under 5, that have malnutrition. Not only the acute malnutrition, which is caused by a short time of deprivation of food, but also chronic malnutrition. So these kids, since the time they were in the womb and throughout their childhood, they have not received enough calories and enough food to develop. This situation, unfortunately, we think may worsen as the efforts to restrict supply into Yemen continue. As for diphtheria, right now in the country we have reports of around 155 cases, and this number is growing week by week. It's still a very concerning situation, especially when we consider that a lot of the population in the country has not have had access to proper immunization and vaccines for the past years, especially before the war and especially worsened since the war started. This is something that we are looking into, and we're going to keep the surveillance and the response as an humanitarian organization. As for cholera, the number of cases have decreased in the past months, especially in October. In the beginning we had around 11,000 cases per day, and in October we had only 500 per week. Sorry, that was wrong. It's 11,000 per week and 500 per week. Should I go back?
You can again.
Okay. So as for cholera, we have seen a decrease in the number of cases, especially in the last month and in October. In the beginning of the crisis, in May and June, we saw around 11,000 cases per week. Now we are seeing 500 per week or even less, and the majority of those cases are not severe and do not require hospitalization. We have consequently decreased our response to the epidemic, as we see that the trend is going down. So some of the facilities have been closed or have been redirected into something else. This doesn't mean, however, that Yemen is not going through a health crisis. The origin of the cholera epidemic is still the destruction of health structure and the collapse of the health system. Does it?
Yes, you can.
So, regarding the access of humanitarian aid, especially in remote and rural areas, this continues to be a challenge in the country, especially since this is still a conflict context. So, as a humanitarian organization, we have difficulties accessing areas of active conflict. This doesn't mean that we are not there. As MSF, we are present in Sada Governorate, in Aden, in areas that still experience a lot of airstrikes, of war wounded, and we try our best to be in all sides of the conflict. But in a country as big as Yemen, and with all the difficulties and the needs, it's a challenge as the humanitarian organizations try to access all the areas that need support.
You can repeat the question if you want.
Okay.
For example, you can say for your question about blah blah blah.
Okay. So for your question regarding the plane, the arrival of a plane in Sana'a airport with supplies, humanitarian aid supplies, this is obviously not enough for the needs in Yemen. We are talking about the needs of millions of people. It cannot be, even if the airport is open, it cannot be solved by humanitarian aid supplies once a week. What needs to be done is the reopening of the commercial ports, especially in Hodeidah. We know that the food supply in the country, most of it is imported. And Hodeidah, even before the blockade, was operating with only 10% of its capacity. It means that the prices of food supplies, of fuel, of everything that is needed by the population continues to rise year by year as the crisis continues. And now, with the current effort of blocking Hodeidah port, we have seen the impact in the populations that we treat. So they don't have the access, for example, for medications that are imported, such as insulin. They don't have access to fuel, as the prices are rising, so they don't have the capacity of taking cars or public transport to reach us in the hospitals. So this is an issue that cannot be solved simply by humanitarian airplanes. It needs to be solved by the reopening of the commercial ports.
You want them to open the airport and airports?
We need the population of Yemen to have access to food supplies. And this is something that unfortunately has been quite difficult in the past years. And it has become increasingly difficult in the last month. They don't have access to food and they don't have access to imported goods, which for them means fuel, for example. And the increase on the fuel prices has an impact in everything, has an impact in access to transportation, therefore access to the health centers and the hospitals. It has an impact, for example, in people who depend on water pumps to get the water. You know, the majority of the population in Yemen, they depend on these water pumps and water wells to get their water. So if the fuel is not there or if it's too expensive, people reduce their consumption of water, which after a cholera epidemic, you can imagine the consequences that it has.
Thank you so much.
Yeah. Is it all?
Yes.
Was it good?
Yes,
Yes, perfect.